Women have the right to health. The right to health is the economic, social, and cultural right to a universal minimum standard of health to which individuals are entitled.
My understanding of the right to health means that health is a very broad term. When we are talking about a healthy person, we are talking about mentally, physically, socially. So when we are talking about rights to health, we are saying a person should be able to go to a medical center and get help on any issue that they might need, whether it's physical, it's emotional, or it's mental.
The right to health entails that a person has the entitlement to be for the state to make sure that they are physically fit, that their mental well-being is well taken care of, and that also their social well-being is also taken care of. And right to health is not merely the absence of disease, but all these other things that I have mentioned.
Good health is essential to leading a productive and fulfilling life of dignity, and the right of all women to control all aspects of their health, in particular their own fertility, is fundamental to their freedom and empowerment.
Firstly, women should have the right to information, to correct information, so that they can make an informed decision about whatever they need or the health care that they need. Secondly, women should also have right to clean water and sanitation if they are within an institution. And then thirdly, they should have the right to health. Even when they do not have the money, the state should make provisions for women who do not have money to be able to access health.
As a community, I think vamwe vanhu havasi kukwanisa kuwana marights aya ekuva neutano nepamusana pekusatoziva ruzivo chero runenge ruri shoma asingatozivi kuti ndinofanira kuita sei kuti utano hwangu hunge hwakachengetedzeka.
Every woman has the right to the highest attainable standard of health, which includes the right to a dignified, respectful health care throughout pregnancy and childbirth, as well as the right to be free from violence.
Tinofanira kugara tichiwana zvakakwana pane zveutano, kuna kuti ndikarwara ndikatemwa nemusoro ndawana here parasite, ndiri munhukadzi ndava kuenda kuchipatara ndodo family planning ndaiwana here, saka tofanira kugara tichiwana zvakakwana pane zveutano.
I understand the right to health as a basic need for every human being in terms of being healthy in order to maintain the fitness of the body, the mind, and also a safe environment so that people will be able to live happily and without the risk of many diseases.
COVID-19 has negatively impacted on the health delivery system. One of the areas that has been hard hit is maternal health.
The situation around COVID-19 was at some point deplorable, when health services literally closed down, with health workers withdrawing from service provision because of the COVID fear. However, with the COVID scenario having come down, we are seeing services being restored. We are happy that even our local clinics, our central hospitals, and all institutions are now providing the service almost at full capacity. Though, of course, we are still witnessing the backlog of people that had not booked during the COVID concern, but our services are almost restored.
Especially during this COVID phase, a lot of people have been out of work. They haven't had access to a lot of financial help from the companies or wherever they have been working. So I know of people who have not registered or who have not gained anything from the local clinics because they have no money. So I believe that is one hurdle that is there at accessing maternal health.
Pane nguva yatanga tichirarama ye lockdown yatidari KE yakava ne challenge kumadzimai mazhinji, nekuti dzimwe nguva vaienda kunobatsirwa kuchipatara vowana zvakaomerawo vana mukoti kuti vavabatsire vakasununguka, nekuda kwekuti denda iri raityisa, kana kuti panguva yacho vanhu vaikwanisawo kuvabatsira vanenge vasipo vairwara. uyezve chimwe ndechekuti vanhu vazhinji vanoomera kana pari pamaternal health kunonyoresa chaiko kuzvipatara kuti vasununguke zvakanaka. Vamwe vanoti tinoponeswa kumachechi, vamwe vanotiwo tinoponeswa nanambuya mudzimba. Izvi zvinenge zvine dambudziko nekuti ruzivo rwakakwana havana. Pakaitikawo machallenges ekuti panenge pakuda madoktazi kana kuti pakudawo kana mishina yemuzvipatara zvikuru kuti vakwanise kubatsirika, zvinopa kuoma. Saka izvi zvinokonzeresa kuti kuparara kwevana vadiki vachangozvarwa, kuomerwa zvakare kwemadzimai avo, uyezve vana vazhinji vanopedzisira vakungozvarirwa pamaenvironment aya asina kunyatsoshambidzika zvokuti zvinogona kungokanganisawo zvakare mai vacho nemwana wacho.
The nurses' strike, lack of knowledge by women in the communities, as well as lack of adequate resources for accessing health care, has negatively affected women's access to health care.
I think of late there has been a number of issues that women have been experiencing whilst trying to access maternal health services. We have had a protracted nurses and doctors strike that was there from 2019 through to 2020. That was a major challenge for women who were trying to access maternal health services. We also have had the challenges that have been brought about by COVID-19 since 2020, and this really has affected women's access to maternal health services, as there was a requirement in some institutions that the women who are in labor get a COVID test before they are attended to. So this has really pushed women into shunning health centers for delivery. Another issue that has come into play is the issue of cost recovery, where women are required to pay a certain amount for them to be able to access maternity services. So these are some of the issues that women have been facing. We also have been noting that there is some lack of knowledge around facts like when should someone book when they are pregnant, but this is some of the information which we have been sharing with women at community level.
Kuna mwana wangu asitorina access yekuti vange vachiona pazvinenge zvitaurwa, kwetawo kuti like sekumaruzeva havana nguva yekuti vanonyatsoendawo pamakliniki vachinyatsowana ruzivo rwokuti vabetsereke kuti vazive kuti utano hwavo hwakakosha sei.
Transport remains a major challenge for women in their quest to access the right to health.
Hatisi tose tiri kukwanisa kuwana kodzero yeutano iyi kana kuti zvine chekuita neutano. Zvimwe zvinotadziswawo nekuda kwokuti kunogarwa kunenge kuri kurewo pane kuti vawanewo zvakaita sezvipatara, vana mukoti kana vamwewo vanodzidzisa zveutano vanenge vari pasi pasi.
Pandinoona nedambudziko ndere transport, ndakanangana pamunhu womukadzi kana akazvitakura. Unogona kurwadziwa uri kumba kuti ukasike kuwana help. Unonoka kuwana help kuti utsvage mota uende kuchipatara. Kazhinji kacho vamwe vanozosunungukira mumba, mozonzwa kuti mwana afa, wozonzwa kuti amai vadai nenyaya yekuti yekushayikwa kwetransport kuti timhanye tiende kuchipatara.
Some of the women are failing to access the right to health due to religious beliefs that result in some women shunning health institutions.
Marights aya eutano anoita kuti asazadzikiswe zvikuru kuvanhukadzi. Zvimwe zvacho zvinokonzerwa nezvitendero. Pane zvimwe zvitendero zvichiri kubatirira nekurasisisa vanhukadzi vachiti zvakafanana nezvipatara kana kurapwa nemishonga yekunze. Vanoti hazviwirirani nezvitendero zvavo, uyezve havabvumidzwe kuenda kunovhenekwa kana kunorapwa muzvipatara zvikuru zvinorapa vanhu vakasiyana siyana.
Kuna mwana anogara kune malong distance nekumakliniki, saka vanhu ivo vanozopedzisira vaakuzvariswa nanambuya nyamukuta. Zvozopedzisira zvinhu zvakukanganisa, pamwe pakusunuka paipe abvarukira haasi kukwanisa kuzosonwa, robva ratova dambudziko ratokura kwaari nepamusana pekuti haana access yekuti aende kuchipatara.
The Patient's Charter is a document that was put in place by the Ministry of Health and Childcare of Zimbabwe with the aim of improving the relationship between patients and healthcare providers by helping or allowing the ministry to listen to and act on people's views and needs, setting the best possible standards of health services and providing health services which meet these standards.
The Patient's Charter is a progressive step towards ensuring that clients get the best out of any health institution. But the challenge is in terms of when it comes to effectiveness is the issue around awareness, that there's not much awareness from people about how they are supposed to be treated when they walk into a health facility. And then also the issue around it's one thing having the charter in place, and it's the other thing having it implemented, because we have long-standing attitudes that are prevalent within the health delivery system that need to be addressed. And without addressing those, the Patient Charter remains a pipe dream for many.
Women have the right to health through legislation, policies and frameworks such as the Patient's Charter. However, most women do not know of the existence of such a charter, and yet this charter protects the patient.
Our constitution provides for the right to health for every citizen, and even every person who is in Zimbabwe, even foreigners, have that right guaranteed by our constitution. So we do have a constitution that speaks to the right of health, and we also have the Public Health Act that is there to ensure that everyone has access to health.
We really have done a lot of awareness raising on maternal health, highlighting the fact that access to maternal health is a woman's right. It's a reproductive health right. Access to service and access to information is also a right. We also have been talking about the right to contraception because we realize that as soon as someone is delivered, they might need contraception. So we've been highlighting all those needs by women so that they have healthy lives and healthy babies.
Quality health delivery is attainable only if existing policies are supported by adequate infrastructure and financing.
Vanhu vese vanofanira kuva neaccess yekuti vange vari padhuze nechipatara ndokutoti vakwanise kunge vachinyatsowa nemadeliveries anenge ari right.
In order for women to access health services, there is need for clinics to be near, and this takes a concerted effort from the government.
Kuzvipatara kuye kunoenda kunobarirwa kana mungava mapolyclinics, mari yacho iripo inonzi ibhadharwe ikakwanisa kuafodwa nemunhu wese. Kune vamwe vanoshayisisa asi aine chido chekuti asunungukire mwana wake pakanaka uyewo utano hwakewo huchitariswa pakanaka. Saka izvozvo zvikatigadziriswei kuti munhu wese ave neaccess to that service pasina chinonzi chatadziswa nechinhu chakaita mari kana kuti kuva pedyo kuzvipatara kumudzimai wese kungawo kunzvimbo dziri kure kure. Ndoona sekuti nzvimbo nenzvimbo hongu zvipatara zvishoma, but pakagara pachiswa anenge mamobile clinics kana kuti masatellite aya anongodhilawo chete nema-maternal health issues.
I think we have mainly worked around the issue of the national budget allocation. We've been advocating for an allocation of 15% to the Ministry of Health when the national budget is being crafted. We also have been advocating for qualified, skilled midwives to attend to women when they are in labor. Another issue of advocacy which we have focused on was the fact that the government should also pay attention or resolve the disputes that they have had between the nurses and doctors during the doctors' strike.
Finance is usually a challenge when we talk about access to maternal health. There is need for some services to be free so that all women can access health.
Women, when they walk into a facility, they should be able to receive what is called preconceptual care. By preconceptual care, we're saying that a woman, before she becomes pregnant, she should be offered health care that enables her to be screened for diseases such as diabetes mellitus, hypertension, which can actually affect her pregnancy. These conditions can be corrected first before a woman becomes pregnant. And then when a woman becomes pregnant, she should have access to antenatal care services. That means early booking, which, by the way, we're saying should ideally be done before 12 weeks of pregnancy. And then she should have at least 8 contacts, according to the World Health Organization recommendations, of 8 contacts during the time of pregnancy. And the woman should actually be able to deliver in a safe environment where there is a trained health care worker. And we're saying for normal pregnancy, the midwife becomes the most ideal healthcare provider for women. And then there is family planning contraception, which should be offered post-delivery. This is very crucial for women so that they plan pregnancy. They have pregnancy when they want it and not as a result of unintended actions.
In ensuring access to health rights, there is need for communities to understand that basic services such as health and water are human rights and not a luxury. From the interviews held with women, it emerged that only a section understand their right to health care. It is clear that not every woman knows their health rights and the services they are entitled to. There is therefore need for a continuous engagement with women so that they understand their right to health and other fundamental human rights that affect their health, implementation of all health policies, and to come up with strategies that address sexual and reproductive health needs of all women. Adequate health financing to ensure services are physically accessible, financially affordable, and acceptable to patients. This will also ensure we start taking steps to achieve universal health coverage.